At the Emergency Services Telecommunications Authority, a call for help is coming through from a medical centre.
I think I have a stroke patient.
Okay.
He can hardly talk.
Is he completely alert?
He looks quite distressed.
Okay. I'm organising that help for you now.
One, please.
Michaela has been assigned to the case. As a MICA single responder, she is specially trained to deal with critical emergencies like this one.
I'm just heading to a 55-year-old male who is at a doctor's surgery and it's come through as a stroke. A stroke is when there's an interruption of blood supply to parts of the brain, which can cause brain tissue damage, leading to long-term neurological deficits. Patients can either have an ischemic stroke, which means there's a clot in one of the vessels, or they can have a hemorrhagic stroke, meaning that there's bleeding going on in the brain tissue itself or layers surrounding the brain.
We need to do a quick test on him for the paramedics. Ask him to raise both arms above his head.
Yeah. The left side looks a little bit weaker.
Okay, ask him to say the early bird catches the worm.
Okay. His speech is incredibly slurred.
Must be here. The devastating thing with strokes is they can cause long-term deficits and disability. They can also then, in worst-case scenarios, cause you to stop breathing properly, make you lose consciousness, and in some cases, die. Hi, my name's Michaela. What's your name?
Will.
Can you tell me what time this started?
No, it's 10 o'clock. I just finished a bike ride.
And has anything like this ever happened in the past?
Right.
So this started out of nowhere.
And then when we got off the bike, I started talking to myself. I'm not talking right.
Okay. Sudden slurred speech is a classic sign of stroke, and to me, that's ringing alarm bells. With every minute that goes by, more damage is being done to his brain.
Well, Teagues, it's great that I get to go to work with my daughter, be driven around the city.
Across town, paramedic and proud dad Brett is on shift for the first time with his 27-year-old daughter, Tegan.
I love everything about this job, but to have my daughter follow in the same footsteps is absolutely brilliant. I remember you just out of nappies, used to come down to the ambulance and run around with your brothers and jump in and use the lights and the sirens.
Dad's always been a huge inspiration for me, and growing up, I always wanted to be just like him. So 5 years ago, I decided to become a paramedic. And when I graduated, I don't think I've ever seen him so proud.
Gonna be a good day.
Yes.
Emergency services. Okay, tell me exactly what happened.
I've got a lady here who's fallen down a flight of outdoor stairs and she's quite badly cut her knee open. She's in a lot of shock.
Is there any serious bleeding?
Yeah, there is.
139, fallen injury hemorrhage.
Received. Right, 49, you're fallen downstairs, so she could have rolled down a few. Looking for a head strike, conscious status, bleeding, fractures.
And then why has she fallen down the stairs? Has there been a medical event that's happened prior to cause this?
We're not sure how far she's fallen, but I've seen people sustain serious injuries just from falling from a standing height, so this could be bad. Hello. I'm good, thanks.
Good. The ambulance is just arrived.
What's her name?
Just on the phone to the husband.
Ali.
This is
Ali. Hi, Ali. My name's Brett. This is Tegan. What's happened, young lady?
I lost my balance and
Yep.
probably fell down the fourth one.
Did you feel funny or anything before you fell? Or
No,
you just...
my heel got caught.
I don't know why we wear heels.
Have you rolled forward, hit your head?
I've gone down. No, I didn't hit my head. I hit my knee.
Yep.
That's where the thing is, and then I've rolled.
Okay, so I'm just going to do a couple of checks. If it hurts anywhere where I'm touching on your spine, please let me know. Nothing there?
No.
Okay, what about your shoulder?
No.
Okay, Ali, I just need you to keep your head and neck still.
A spinal collar will be needed, but first, Brett and Tegan need to get a good look at Ali's leg.
Is that somewhere we're touching that's sore? Or?
Yeah, no, it's burning now.
Oh, that's a big cut. When I first see the laceration to Ali's leg, it's quite horrendous. It's very deep, very long, and very painful.
How?
So you're usually fit and well?
Yeah.
Exercise quite a bit?
Yeah.
Back at a medical centre in Bayside, Melbourne, Michaela is worried Will could be having a stroke. The father of 3 had just finished exercising when he suddenly couldn't speak.
Do you have a headache at the moment? No.
Will looks very, very concerned, which is completely understandable. Only an hour ago, he was out riding his bike, and now he's worried that he's having a stroke.
Super fit. Yeah, he looks it.
Will's friend of 12 years, Marnie, was on her way to meet Will for a swim when he phoned saying he was in serious trouble.
I got a shock because his voice was quite slurred. I said, "You sound funny." And that's when he said, "I think I'm having a stroke." I know Will's dad died of a stroke a couple of months prior, knowing that. I just thought, oh my God, what if I lose my friend today?
All right, Will, your heart looks all fine, okay? Can you reach up and squeeze both my hands? Good. Pull me towards you.
So I need to do a stroke assessment on Will, which includes me testing his strength of his arms and legs.
Lift that one up and let me count to 10. 1.
I'm looking to see if they drift or move or they become weak.
Can you smile for me?
I'm checking to see if he has any facial droop or paralysis of the muscles in his face.
Does his smile look normal to you?
No.
On
this side.
Yeah. A bit droopy. Can you say, "You can't teach an old dog new tricks"?
You can't teach an old dog new tricks.
So his speech sounds a bit slurred?
After my assessment, I think that it's very likely that Will is having a stroke. My biggest concern right now is that the bleed or the blockage in Will's brain gets worse, which can make him rapidly deteriorate.
You right? We'll look after you.
Will is very lovely, generous, gentle. He's probably the fittest 55-year-old that I know. So to potentially lose mobility and coordination, that would be just so hard for him. And he would be so full of fear.
All right, let's do it.
Will is time critical. Every minute counts, and we need to get Will to hospital as soon as possible.
Is that just on the knee that's hurting?
No,
Where
it's
else?
the shin.
The shin, yep.
Just outside Melbourne's CBD, Brett and Tegan are treating Ellie, who's ripped open her leg after tumbling down a set of stairs.
You've got a really long gash across your
I
knee.
know.
Okay, you've seen it? Okay.
Ellie's done an absolute number on herself. So the priority is to examine her leg and check for any fractures and make sure that she can still move her foot.
Can you move your ankle up and down? Look at you go. Can you bend your knee? Lovely.
We'll get that wrapped up.
So pain now? Do you have any discomfort now, Ellie?
No.
No?
I think I'm just in shock still.
So on examination, it appears there's no fractures, but we've got to ask ourselves now what else could be going on here. We need to get Ellie inside the ambulance and have a very close investigation, head to toe. Until we do that, there's no telling what other injuries there may be.
Alrighty, just moving into the ambulance now.
You right?
I feel sorry for myself.
It's pretty scary what's going on.
55-year-old Will lost his dad to a stroke just a few months ago. And today, MICA paramedic Michaela is hoping she can get the father of 3 to hospital before he too suffers the same fate.
They've got a great neurosurgical team at the Alfred and they'll look after you. We just prepare ourselves for the worst case scenario, but you're young, you're fit, and you're healthy. So they're all really good things.
Strokes are devastating and everyone knows just how serious they are. Will loves his cycling and swimming, so I think he's really concerned that his life as he knows it is going to change forever. So I really feel for Will and I can only imagine how scary it must be for him.
Michaela has radioed ahead details of Will's condition, so the hospital team will be ready to treat him immediately on arrival.
You all right there, mate? Yeah, all right. We'll head in now, okay?
So now he will undergo a brain scan. Then, if he needs to go to surgery, he can get there as soon as possible. All right. I'm really hopeful that early intervention means that we will have a positive outcome. But my worry is that he could have some really long-term disability or deficits that he has to live with.
The band's back together. We got the band back together. Yeah. It's always nice to work with my work husband.
Across town, buddies Mike and Eamon have just clocked on for the day. It's their first time on road together after an extended break.
I feel like we've been separated from each other.
Yeah.
And now we've rekindled our love.
We have. It's not a partnership, it's love. I've missed this guy so much. Being back on the road with Eamon, it's where I belong, it's my happy space. It's like nothing's changed. We're back into our groove. It's perfect.
Big news.
What?
As Beyonce said, if you like it, you should put a ring on it.
Did Renee propose to you?
She did. I proposed to her.
Oh, good on you.
Yeah, we got engaged.
Wow.
Renee's the one. I've found my person. She's the one I want to do life with. She's smart, funny, she's pretty hot. Renee's also a paramedic. We've been together for about 4 years now. We've lived together for 2 of those years. We've travelled the world together. We've had some fur babies. It's time to take the next step.
That's excellent news, man. I'm so happy for you.
Oh, thank you. We're very excited. The pressure's on you now.
No, it's not.
Emergency services. Okay, tell me exactly what happened.
It's my husband.
An SOS is coming in from a woman who's worried about her partner of more than 60 years.
He's coughing and coughing and coughing and he can't stop. And he's very flushed in the face.
Sure, well, let's get him some help.
So, mate, we've been called to an 84-year-old male who's unwell, coughing, flushed. It's coded as a chest pain. It says he has been coughing and has pain in chest from coughing so much. Elderly patients can be incredibly dynamic. They can be pretty well one moment and then deteriorate suddenly. So it's important we get there as quickly as we can. Oh, it's not good. Squeeze down. It's only another 2 Ks, but it's going to take us a while to get through all this. RC139, we're delayed in heavy traffic.
We want to get to this patient quickly, and we need the public to help us. If you see an ambulance coming up behind you, all we ask is that you very calmly put on your indicator and move to the left.
There we go. See, this one's been listening.
Fortunately, we're able to get through this traffic pretty quickly, which is a relief, because the faster we can get to this patient and find out what's going on, the better.
Paramedics! Hello.
Hello.
I'm Mike. I've got Eamon with me.
What was your name, darling?
Lynette.
Who's the patient?
My husband, David. Straight down and then turn.
Hello.
Having a bit of trouble. Coughing all the time.
Yeah, you do sound distressed. How long's that been for?
Started at 8 o'clock this morning.
Okay. David's feeling really unwell. He's got this nasty cough. It just sounds awful. He's also got a bit of chest pain, which is always concerning, and we're not quite sure what's going on, so that's got me worried.
Got sore on the left flank. Might just check that out if that's okay.
49-year-old Ellie took a serious tumble down a flight of stairs, resulting in a nasty laceration below her right knee. Brett and Tegan are also checking for any internal injuries.
Yeah, that's a bit sore.
If I press here on your ribs,
No.
I can't feel any crepitus. I'm tipping a soft tissue injury because you've bumbled down a few stairs there. Pop your arm in. Good news is there's no obvious injuries and no massive internal bleeding. However, we need to go to hospital so they can take a good look. Rightio, I'll give you 2.5 of morphine. We'll keep on top of the pain. How's that?
Okay. The irony of it, I went for a walk because there was this report really stressing me out, and I just needed to, get a breather.
This is the last thing you needed today, Ellie.
How long do you think I'm going to be in hospital? My 14-year-old's got a birthday party on Saturday.
Okay.
The weekend's only a couple of days away, and unfortunately, we've got no way of knowing how long Ali's hospital stay will be. It really depends on how much damage she's done to her leg and if she's injured any other parts of her body.
Alrighty, we'll get you inside.
Thank you, both of you. You've been fantastic.
I can hear there's a lot of phlegm up there.
Back with Mike and Eamon, the distressed 84-year-old patient David cannot stop coughing.
What sort of medical problems have you got, David?
What's like asthma, diabetes, atrial
fibrillation?
That's...
Sure.
David's wife of 63 years, Lynette, called an ambulance when David felt like he couldn't cope anymore.
David is tough. 6 years ago, David was on the ladder cutting the hedge and then he fell to the ground.
Just breathe in and out through your mouth for me.
He broke his back in 6 places. He hit his head and had a bleed on his brain, but he never complained. So when he does, I know there's something wrong with him.
So right now, your oxygen levels are not too bad, but I can hear there's a lot of fluid in the right lung there, from basically the bottom to the top.
It's important we do an ECG or take a picture of David's heart to see if this coughing and shortness of breath is starting to impact his cardiac function.
Just stay nice and still for me. It's almost done. All right. So there's nothing ischemic on here. So my suspicion at the minute is you may have a chest infection. So it's probably reasonable that we take you up to hospital to get sorted out.
For older people or people with health problems like asthma, a simple cough or cold can progress to become a serious chest infection like pneumonia. Pneumonia can be a really dangerous condition, and if it's left untreated, you can die from it.
Does he need a dressing gown?
Oh, we'll give him plenty of blankets to keep him warm.
Oh, OK. Well, David's the love of my life and he always was. We've known each other since we were 17. I'd be devastated if anything happened to him. I don't think I could possibly go on. I'm just hoping that David will come home quickly.
Looking forward to today, mate.
Yeah, same. You are one of the most adorable characters I've ever worked with in my life, and the patients love you, if only they knew the truth.
Also on the afternoon shift, a mobile intensive care paramedics and good mates, Dodsey and Andrew. With more than 40 years' experience between them, they're considered legends in the ambulance world.
I remember coming to MICA 11 as a student, having you as a CI.
Yeah.
You changed my whole aspect of MICA.
I've known Andrew for about 22 years now, and as a student, there were some things that I struggled with or didn't get my head around, and Andrew spent a lot of time. He'd come and see me in his own time and help me through things. I just learnt differently than some others. So he's very supportive, very loyal, and he's a very good man.
You're a rough diamond, Doddsy.
Yeah, absolute rough diamond, but, you know, all rough diamonds are very well created under pressure.
I don't think I'm more proud of anyone than Doddsy because he was so different in how he went about learning. To look at him now and what he's achieved in his career, I'm just filled with pride for the guy. I love being with him. He's a character.
Arrest. Let's go.
But the trip down memory lane will have to be put on hold as they're dispatched to a priority 0. These are urgent cases where someone could die without medical intervention.
Right, just being updated by the call taken now. It looks like it is an MVA involving a motorcycle.
Hold on. MICA 30 received. These are really highly charged cases. The patient's in cardiac arrest from road trauma. This is the worst case scenario that we get. His injuries are so severe that his heart's not pumping anymore. He's only got minutes to have any chance of a positive outcome.
Just stop.
I can hear on this side of your chest there is a bit of fluid in there.
In Melbourne's southeast, Mike and Eamon are on their way to hospital with David.
Have you been able to get anything out?
No.
The 84-year-old is having severe coughing fits, and the cause is still unknown.
I know the cough's what's bothering you the most, but the main reason of going to hospital is to get you investigated. David's an asthmatic, and it looks like he may have a chest infection. If untreated, that could turn really nasty. What do you do to pass your time?
Used to play golf today. I'm getting it a while. I could, yeah, but I wouldn't be able to walk around.
Do you get pain walking long distances?
Yeah.
So what have you taken up instead?
There's 4 of us, we go to lunch every month.
Beautiful.
So a couple of beers.
Couple of beers, that's it.
As you get older, it's so important to maintain your physical health and also your mental health. And one of the best ways you can do that is getting out and socialising.
All right, we're just pulling into the hospital now, David.
I hope that when I'm David's age, I'm still catching up with the boys for a beer.
All right, my friend, you sit tight. We'll take you in on the bed, OK? Now we're at hospital, David will undergo some tests to try and find out what's causing this nasty cough. I'm really hopeful that David's symptoms are caused by a straightforward chest infection that'll be cleared up just with some antibiotics.
Feel good, mate?
Hopefully it's not too long till he's back home with Lynette and he can make his next lunch.
So obviously, Paul, we've got the highest end of time criticalities, but the chance of a positive outcome is having rapid interventions.
Yep.
Veteran MICA paramedics Doddsy and Andrew are heading priority 0 to a critically injured motorcycle crash victim.
So we're going to have to prioritise our care. Yep. Chest decompression in case they've got a collapsed lung, volume loading with aggressive fluid therapy, splinting and oxygenating them. So we've got a number of things to do in quick succession.
Yeah, definitely.
We are going to be very busy when we get there.
Yeah, we are.
It's likely to be an horrific scene. And apart from preparing clinically, Andrew mentally readies himself for what he is about to see and do.
I believe really strongly in the concept of an emotional body armour. A uniform is not just a piece of cotton. It gives all paramedics a level of emotional protection.
MICA 30 on approach.
It gives us the ability to go, I'm going to thicken the armour and give myself at least a bit more resilience.
Hey, guys.
The crew on scene have been treating the patient's head, chest, abdominal and limb injuries.
All right.
Significant trauma.
Yep.
GCS 3, we're getting some ventilation, limited rise and fall.
Roger. I'm going to do both sides of his chest. I'll get Paul to jump in and we'll go from there.
The patient's got severe chest injuries, which has probably led to a collapsed lung that is then preventing his heart from beating. What I now need to do is make a cut into his chest wall and insert forceps and then my finger to try to reinflate his lung.
Got it? Just through now. His lung is all the way up.
Yeah.
So nowhere escape?
No.
I'll just come round to the other side.
Yeah.
Hold on, there's the lung just then. It still hasn't inflated. I can feel the lung posteriorly and just a pool of blood.
Yeah. So the damage is at a point where there is nothing further can be done for this patient.
Pupils are fixed and dilated.
All right.
One of the hardest decisions we make in ambulance is to call a job, but unfortunately, this man's passed away.
So he's had bilaterals, he's had splinting, volume, ventilated. All right.
So we try everything that we can to resuscitate someone in these settings, and it is really disappointing when you're unable to save that life. And it does upset you, it does take its toll, because that is someone's loved one, it's someone's brother, their father, their dad, and they're not coming home tonight and they're not going to work tomorrow.
Big job, mate.
It's just really sad how quickly the day changes. When these things happen, it's very important to take a moment just sitting in the car with your partner and debriefing. talking with somebody that you trust, because mental health in this job is paramount.
I think when you observe paramedics in that acute setting, everyone always comments how calm and controlled it is.
But we're human. We're still vulnerable to some of those things that we say.
Yep.
So it doesn't mean that it doesn't affect us. When I started in ambulance, we never spoke about these things. And I think the beauty of ambulance now is the ability to not be afraid to have those discussions, not be afraid to ring your mate and say you're having a bad day. It's healthy to, at times, be vulnerable and understand that, you know, where your boundaries are, and that you go like this and go, hey, I just need to go home.
Yeah.
I've learned a lot over 25 years in the job. I've learnt you can't bottle things up, you can't push it down, it'll just destroy you. The support structures that are around me now mean that I can push through and be an effective paramedic and a healthy person. It's not easy, but what drives you is that you'll go to that again on the chance that you'll give someone a positive outcome and return them to their family.
Emergency services. Okay, tell me exactly what happened.
Behind every call to emergency services is someone having one of the worst days of their life.
I think I have a heart attack. I can't move my arms. I've got cramps in my back and in my chest. I had a heart attack before, and I think it's the same thing.
All right, I'll organise some help for you now, okay?
RC139, code 1.
Paramedic partners Erica and Taz are now being sent lights and sirens.
All right, Erica.
Yes, Dad.
We've been dispatched male with pain in chest and back. He has taken 3 into 100 milligrams aspirin.
Okay.
Feels like previous heart attack.
If someone has a heart attack in the past, it's the feeling you can never forget. So when someone says this feels like his previous heart attack, we genuinely believe that that is the case. So he's time critical.
So plan of attack will be, let's do a 12-aid.
Yep.
And early transport.
Yeah, absolutely.
Taz knows firsthand just how critical these cases are. It was one of the reasons why he left India and moved to Australia to become a paramedic.
When I was in India, I lost my uncle and my grandfather to heart problems, and there was no pre-hospital help at that time. I very strongly think that had they been given a pre-hospital care, the outcome could have been different. So these jobs are very close to my heart.
Hello. What's your name, sir?
Edward.
My name is Taz, and I've got Erica with me. So what happened today?
I've got awful cramps in the back.
Yeah.
I can't feel my arms.
When did that start?
About an hour ago. It feels like I'm having a heart attack. I had one before.
Edward appears quite pale and he's complaining of excruciating chest and back pain. If Edward is having a heart attack, his heart muscle could already be dying. We need to act quickly, because if we don't, this could be fatal.
How's the city at night, mate? Beautiful to look at.
Newly appointed MICA paramedic Leonard is teaming up for the first time with 20-year veteran Cullen.
The hard part about working at night is fighting your body clock after midnight.
I don't know if you drink much coffee through a night shift, but I've got to keep going and drinking it right throughout to keep up that performance.
I'm super excited to be working with Leonard. Not only is he an all-round top bloke, but he loves being a paramedic. If I or one of my loved ones was sick, I'd want Leonard turning up. I think that says it all.
Night's a part and parcel of our work, and we're there to serve the community, no matter what time of the day or night.
Yeah.
Emergency services. Okay, tell me exactly what's happened.
He can't breathe.
A distressed dad is on the line calling about his 6-month-old baby who's in serious trouble.
He's been to eat something.
So is he choking on something?
Yes, something. Please come.
MICA 30 received that. So we've just been sent to a 6-month-old choking. Patient's face had turned purple before calling for an ambulance.
Yeah. Every paramedic, when they hear a 6-month-old baby or a young child, you know, your heart drops a little bit because it always is more stressful working with children who are unwell. As a parent myself, I know the children put things in their mouth. It's what kids do, and it only takes a split second for them to choke and stop breathing.
Mum and Dad are going to be absolutely hysterical, aren't they?
He's still conscious, hopefully coughing up a little bit, but if not able to cough, we're going to have to do some back slaps and alternate with chest thrusts. Obviously, if he goes unconscious, that's when we're going to start to pull out a few of our tools. And heaven forbid if we get worse than that.
On a way to a case like this, we prepare for the worst. Children's anatomy is vastly different from an adult. They've got very small airways.
Clear left.
Everything's on the line here, and the moment I open that door, I have to be absolutely on my game. I can't waste a single second.
G'day, mate.
Thank you so much.
My name's Leonard. Who is the patient?
Titan.
Titan. We're here now.
As I walk in, I see baby Titan lying face down on the couch, unresponsive, and my heart just sinks.
Edward, how would you rate your pain out of 10?
8 or 9.
8 or 9.
Across town, Taz and Erica's patient, Edward, thinks he's having a massive heart attack.
Have you got any other symptom?
I feel like I'm going to vomit.
Okay.
And I've got more bad back.
Okay. Every individual is different, but Edward is ticking all the boxes of some classical features of heart attack. He's got chest pain, pain in his back, he's feeling nausea, so we need to act right now.
So Edward, just staying nice and still while we do this tracing of your heart, okay? That's good, just as you are there. There it is. RC139, can we please have MICA code 1 for a STEMI, please? We've identified that Edward is in fact having a heart attack. So the stakes are really high right now. Edward's life is in our hands. We're going to take exceptional care of you, okay?
Erica, can you also attach some pads?
All right. We'll just slip your shirt off, mate, just because I want to put a couple more stickers on your chest. So applying the defib pads is really important because in the event that Edward does go into cardiac arrest, we're able to shock his heart back into a normal rhythm as quickly as possible.
Okay, Edward, this is a drug called fentanyl to help you with your pain. So started with 50.
Yeah.
I'm just going to give you something for your nausea also, okay?
So it's now time to get Edward onto the stretcher. All Edward has to do is take a couple of steps. We want to minimise any unnecessary movement to avoid putting strain on Edward's already damaged heart. Nice and easy. So Mike's just arrived, mate.
All right.
Guys.
Hello, how you going? This is Edward.
Kat. Hi, Edward. We're going to get you in the ambulance and then we'll get you off to hospital, okay?
So at this point, Edward is critically unwell. We've identified that there's a blockage in his heart. There's a portion of his heart that's not getting enough blood and oxygen. So we need to get Edward off to hospital right now.
Hello. Not quite the night you planned, eh?
Paramedic Kat has administered heparin to prevent blood clots and notified the hospital they have a STEMI patient en route.
All right, so Taz, we've got adrenaline 1 in 1,000. We've got pads plugged in.
Yeah, okay.
She is now drawing up resuscitation drugs in case Edward's heart stops beating.
We're at the hospital, Edward.
So there might be a bit of a fuss over you when we get in there. And so Taz, put the backboard from Lucas behind you.
Oh, yeah.
And the BBM.
Okay. Heart attack patients are very dynamic, so we are taking all the CPR equipment and preparing in case Edward goes into cardiac arrest, so we can give him mechanical CPR and bring him back to life.
Just a few little bumps on the way out, Edward, okay? Taz and I know that we've done everything that we possibly can for Edward, and it's now up to the team at the hospital. I'm hoping that Edward's going to be okay, but the thing that this job does teach you is that there are no certainties.
Hello.
Leonard and Cullen have arrived to treat 6-month-old Titan, who was found choking and turning purple by his parents, Janet and Bruce.
I'm just picking her up. Hello, there you are. Do you want to hold Mum? I'm very glad that Titan is crying. That's a good sign. Just tell me what's happened leading up to tonight.
He pulling a while, and then suddenly we heard some sounds like talking.
Like coughing, like trying to cough something up?
And then the face looked really unwell.
So no one saw. So when you walked in, Titan was already making a funny face, looking like he was choking.
Yes, I just leaned it on my lap, and then I just packed his bag.
Did anything come out of...
A bit of blood in Titan's saliva could be a number of things. Maybe he's bitten down on whatever the object was and it's caused some bleeding. Hopefully it's not coming from further down his airway.
So lungs are clear, Cohen?
Yeah.
Can't see anything stuck in there. I can't see where the blood would be coming from the outside. I just wonder whether he's got a bit of teething and there's a bit of blood in his gums.
So that's 100%.
Beautiful. Okay, no worries.
The good news is Titan looks to be okay, but even though he doesn't need intensive care treatment, he still needs to go up to hospital and get checked out by a doctor just to make sure there's nothing else going on that we aren't aware of.
Hello.
But before Titan heads off, worried brothers Titus and Tyree want to say goodbye.
He was so scared when
was
he
he?
A backup ambulance has now arrived to transport Dad Bruce and Titan to a nearby hospital.
How are ya?
I'm Olivia.
Thank you.
All right. Take it easy, mate.
So in hospital, Titan can be assessed and observed by a doctor, and hopefully he'll be back home playing with his siblings soon.
Father and daughter team Brett and Tegan were quick to come to the aid of Ellie, who took a nasty tumble down a flight of stairs, ripping open her leg.
How long do you think I'm going to be in hospital? My 14-year-old's got a birthday party on Saturday.
Okay.
Doctors confirmed Ellie had no fractures or ligament damage to the knee, but required surgery to repair the laceration. After a 3-day hospital stay, Ellie, sporting an impressive 20-centimetre scar, did make it home in time for her daughter's birthday party, but then required 4 weeks off work to recover and start physio. Micah Naiman's 84-year-old patient David was in a lot of trouble with a shocking cough and symptoms that suggested a serious chest infection. Wife of more than 60 years, Lynette, feared the worst.
David, tea's ready.
Oh, wonderful. Just what I feel like.
David had a chest infection that almost progressed into pneumonia. He spent 4 days in hospital and had to take antibiotics for a fortnight, but is now back home with the love of his life.
You can cut the cake.
Do you trust me to cut it?
Yes.
It's beautiful to be home with Lynette. I can't say enough about how the paramedics looked after me. I think they're marvellous. Right, I really do.
We're here now.
Baby Titan gave his mum and dad the fright of their lives when he suddenly began choking.
So that's 100%.
Beautiful.
Although Cullen and Leonard couldn't see anything in the 6-month-old's mouth, the baby was transported to hospital for scans.
Thank you. Take it easy, mate.
X-rays confirmed Titan hadn't swallowed anything. And he's now back home happy and healthy with his older brothers.
Feels like I'm having a heart attack. I had one before.
77-year-old Edward was convinced he was suffering a massive heart attack. And he was.
There it is. We're going to take exceptional care of you, okay?
Taz and Erica were swift to call for MICA backup, and the team all did what they could to get Edward to hospital alive. Once there, Edward had a stent put in. And the brave battler is now back at home and recovering well.
It's a great feeling that Edward is feeling better. It's a very challenging job. It demands a lot. But when you make a difference in someone's life, I think it's worth it.
What's your name?
Will. We're going for bike. I sort of talked to myself. I'm not really talking right.
Fitness fanatic Will developed frightening stroke symptoms following a bike ride. Good friend Marnie feared the worst after Will lost his father to a stroke just a few months earlier. Michaela rushed the 55-year-old to hospital, where doctors confirmed Will suffered a devastating brain bleed, just like his dad. Fortunately, Will survived his stroke, and 10 weeks later is back training with Marnie.
In hospital, I was on a drip for blood pressure, and I went and had a CAT scan so they could see where the brain bleed was and how big it was. It looked like maybe a 20-cent coin on my brain. You go, wow, that's quite big. But I'm lucky. I was able to leave hospital after less than 24 hours.
How are you feeling now?
I feel good. I feel good.
Anyway.
Will still has some mild left-sided weakness, but his speech has almost returned to normal.
Will is amazing, the way he's sort of returned to all the things he loves to do. I just will be forever grateful to the paramedics for saving my friend.
I've seen a neurosurgeon since, and he just said to me, we may never know why it happened. So I'll just get on with life. Just enjoy being out there with my friends and just smelling the roses, as much as possible.